Before the COVID-19 pandemic, did you participate in any mask or physical distancing practices? Did that change after medical experts recommended these practices? The mask mandates set during COVID are an example of biosecurity relevant to humans. Alternatively, on-farm biosecurity is preventative management practices to reduce the spread of disease onto, within, and off of farms. Much like doctors advise us, vets have the role of advising farmers on prevention, which improves animal health and welfare, productivity, and public health. Globally, biosecurity is variably implemented on dairy farms, but the reason behind this is typically assumed by vets or other industry experts. The farmer rarely addresses their barriers, creating an obstacle for vets to effectively advise their clients. So how can we remove these barriers? Through interviews, I will explore the barriers for both Ontario vets and farmers for both biosecurity and communication. From this research, veterinary consultation can be individualized and account for the barriers to target the specific goals of each farmer. The specialized approach will also focus on effective communication to initiate behavior change amongst farmers, increasing the implementation rates of biosecurity and reducing disease. So for example, if a farmer is struggling with lameness in their herd, a vet can suggest biosecurity practices, which may include written protocols for detection or treatment, and bedding hygiene or hoof trimming programs for prevention. Lameness is a prevalent welfare and production issue on dairy farms, causing pain and affecting cattle behavior, so addressing it promptly is imperative. If financial constraints do not allow for all the practices to be implemented right away, the vet should approach the farmer with the best options for reducing the problem now and come back to the farmer with those other suggestions at a more appropriate time. The approach also applies for reducing diseases like Johne's and mastitis and preventing exotic diseases. So currently, an outbreak of the exotic disease avian influenza is spreading through Canadian birds, and biosecurity protocols are the primary prevention tool being deployed. While there's not a current outbreak in cattle, being prepared with standardized biosecurity practices will reduce the spread of disease now and reduce the stress of frantically trying to implement practices if an outbreak ever happens. Equipping vets with communication approaches to advise farmers on biosecurity is a necessity to promote preventative approaches, improve welfare, and reduce disease in Ontario dairy.